Hello my dear viewers, hope you all are doing well. Today in this episode I am going to discuss about low vision. Like in one of my previous videos I discussed about visual impairment, and as we know visual impairment has two types. One is called low vision and the other is called blindness. Okay, now my topic in this episode is about low vision. That is, we have vision, we can see, but that vision is not adequate for us. Okay, that is called low vision. I am not blind, it's not my condition that I can't see, but the thing is that I can see, but that vision that I have is not adequate. Okay, is not up to that much which is needed for me to do my daily activities, is like reading, writing, watching TV, etc. Okay, while doing all these things we don't have a clear vision actually, and like we see everything blurred, or like as if we are looking through some fogs. That way we can see. That condition is called low vision. Now when can I say that I have a low vision, or I may have? When can I suspect that I may have a low vision condition? If we are using normal spectacles but that is of no use for us, still we have blurred vision, we can see things blurred. Okay, we got some operation, we had some conditions of eyes for example, and we got it operated. After that also my vision is not clear. Now I can see everything blurred, means that vision is not adequate for me to do my daily living activities and all other things, my hobby things, everything. Okay, or for example I underwent treatment, I took medications, after that also my vision has not improved, then I can say that I have a condition called low vision. Now I want to tell you what can be the probable causes of low vision. We must have heard that someone suffering from prolonged diabetes, that is, that person is a diabetic patient since long, okay, for so many years back. Then what happens, that person has this condition of low vision, or sometimes we hear that that person becomes blind, okay, in an extreme condition. Other than that, one condition is there that's called glaucoma. Out of that glaucoma also we may have low vision. Okay, any kind of eye injury. Another condition is corneal opacity, or scars in the cornea. That is like cornea is a part of our eye, and if we get some difficulty in that cornea, it may have some scars on the cornea, or that cornea may become opaque. Opaque means not clear, blurred type of thing. Much like if we look through a piece of plastic, how will we see? We will see everything blurred. That kind of vision is called opaque vision. These are the main causes or major causes of low vision, and in some cases we see that some children has problem of vision, low vision condition since birth. Okay, now coming to the part of management, like what can be done in terms of management of low vision has that effort that whatever vision we have left with us, that is the residual vision that we have in our eyes, that vision, how we can use that vision to the utmost level so that it becomes good for us, so that it becomes useful for us to do our daily living activities or all other activities whatever we do. Okay, that part comes under management. Now at first we need to approach an ophthalmologist, okay, so that we actually come to know what is the actual condition that's going on inside our eyes, okay. And accordingly some devices will be advised for you. Among these devices, some devices are called optical devices like CCTV, hand magnifiers, magnifying glasses, reading prisms, okay, these things can be used. Other than this also, some non-optical devices also can be used. Non-optical devices means devices that are not directly related to my eyes or eyesight. That means I can modify my surroundings to some extent so that it becomes friendly for me to look clearly, okay, so that I can do my works. For example, if one light in a room is enough for a normal person to see clearly everything and anything inside that room, or even doing his own activities, reading, writing, watching TV, doing other works, everything, then if I am a person with low vision, I can use one extra light in that room. While doing my writing works, while doing my reading works or study works, I can use one extra table lamp also. But in this thing, we need to understand that that light, whatever is the light in that room, that light should not create shadow on the things that I am doing. For example, I am writing and there is enough light in this room, for example, but whatever I am writing, there is a shadow. Maybe that light is coming from my backside, okay, or I am writing, I am a right-handed person, I am writing and that light is coming from my right side. Then what will happen? Definitely whatever I am writing in that space, in that place, it will be on my notebook, it will be a shadow, okay. So that should not be done, okay. Direction of the light and my sitting position should be properly adjusted so that whatever I am doing and wherever I am doing, that particular thing gets enough light so that it reflects much light and it becomes easier for me to see properly, okay. Other than that, some low vision devices are advised for school going children, or the textbooks can be modified to be printed in a large font, okay, so that it becomes easier for a child to read. Mainly these type of curriculum adaptations are done in case of school going children, okay. In short, this is all about low vision. Hope you all have understood very well. Thank you so much.